good morning. It's Wednesday, and it's Wednesday in the month of October. Is it 16th? Yes, today is the 16th. I'm wearing pink because the month of October is Pinktober, or Pink Month, like we normally refer to it. And we did not share any space on this platform. I mean, really share some space on this platform to recognize, to identify, and to acknowledge the awareness of cancer for this month as well. So we are going to be doing this feature. But we need to now go over to Kendall first. Got to see what's going on in the newsroom, don't? Let's see what's happening there.
Good morning. The Minister for Tourism is predicting the highest visitor arrivals since the country reopened after the COVID-19 pandemic. He made the prediction at Monday's pre-cabinet press briefing.
Last week, we officially commenced the 2024-2025 cruise season with the arrival of 2 ships, and thereafter, of course, as the season progresses, you'll be seeing more arrivals. We're expecting the calendar year 2024 to be the highest arrivals in any single calendar year, and that surpasses the year of 2019, as well as the highest number of cruise ships that will be docking in the harbor.
The minister also announced that final drawings from the Global Ports Holding project will be submitted to the DCA for approval to commence port rehabilitation. The Ministry of Health is urging public vigilance as dengue, chikungunya and Zika cases continue to be recorded. The 3 viruses are transmitted by the Aedes aegypti mosquito and are currently circulating in the Caribbean region. Early symptoms of these illnesses include fever, headaches and flu-like body aches.
An incubation period starts from the bite of an infected mosquito and ends when signs and symptoms first appear. These illnesses have at least 3 symptoms in common, which are fever, headaches, and flu-like body pains. The chikungunya virus has an incubation period of 3 to 7 days. It causes inflammatory arthritis and polyarthralgia, which is multiple joint pains associated with morning stiffness.
She says severe chikungunya cases may lead to brain inflammation, heart and lung failure, kidney failure, or even death, especially in older adults or those with chronic conditions. The Water and Sewage Company, Inc., WASCO, has launched a comprehensive communication strategy and action campaign aimed at fostering a climate-conscious nation that recognizes the need for water security.
We all know that water is life. It's at the core of everything we do. But the reality is our water and our way of life are under threat. But here's the good news. Together, we can make a difference. At WASCO, we're not just a utility company. We're stewards of St. Lucia's most precious resource. That's why we are embarking on a new communication strategy, focusing on climate change, adaptation, and resilience.
The 2-year campaign under the theme Secure Our Water, Secure Our Future seeks to address the pressing challenges posed by climate change on the island's water supply. A financial information fair held at the Constitution Park in Castries on Tuesday was geared at spurring more interest in investing.
We want persons in their discussions, in their financial discussions. When you discuss your savings, when you discuss your budgeting, when you discuss your insurance, also discuss financial investing. There are opportunities available. It's not as difficult as we may think. It's a simple conversation with your bankers to decide on an investment vehicle that's appropriate for you as an individual.
The activity forms part of Financial Information Month, which is being held under the theme Financial Investing, from Savers to Investors. That's your news summary. Thanks for watching.
All right. Thank you very much. Over from the news desk. We take a break now and come back. I mentioned, this entire program today, we are going to be surrounding the awareness of cancer. So we caught up with, again, as we normally do this time of year, the president of the St. Lucia Cancer Society, Dr. Tamara Remy. Well, it is the month of October, and it's that time again, and obviously we expect to find our good friend here, Dr. Tamara Remy, who so willingly gives us her busy time, especially during this month, to ensure that she taps in with us, and whenever we make the call, she don't say no. So we appreciate that first. Dr. Remy, thank you again.
Thanks for always having me.
We have a new conversation we need to have when it comes to the cancer, because you've been there, and I know sometimes it can get a little challenging because you see it, you're advocating, you're doing so much within, wearing your hat as the president of the Cancer Society. But sometimes, you check yourself, because in terms of the numbers, what have we been seeing? What has the numbers been seeing?
There's no reduction in the number of cancers generally, and certainly not in the number of breast cancers. We're not seeing a reduction, which is not very encouraging.
I know.
But, it's one of those things that we will eventually see. So I don't want to say it requires patience. It just requires continued advocacy, continued education, continued pressuring and pushing forward needs to actually be done. Some things are long-term. Other things you can see immediate effects, but when it comes to healthcare, cancers, chronic diseases, it's going to take 10, 20 years before we actually see the benefits of what we've been trying to do.
So you're definitely hopeful.
I am hopeful. I am hopeful. In between the mix of the disappointments, sometimes you wonder, are we really making a difference? It's a question that I think I've been asking myself more and more when I see younger patients or patients who you wonder, well, where we've been speaking, all these different advocacy groups have been speaking, like, where are we not meeting you? Where we're not preaching and reaching out to, that you can't hear the messages that are being sent,
Have you been able to pinpoint anything when you go through your...
No. Last year, we tried to reach out to the Folk Research Center, because I thought maybe we need to be speaking Patois as well. We didn't go very, very far with that, but there was a lot of interest. And I wonder if maybe for some communities, if that's a deterrent. But the majority of people who I am seeing don't speak Patois, so I don't know that is necessarily a big influencer.
Let me ask you, is it that the information is not reaching, or maybe the information, when it gets to them, it's been misinterpreted in some sort of way? Because we say early screening. For instance, we say early detection is going to go a long way. But early detection means that we could catch this at a certain point where we can actually treat it at a public service level.
Right.
And most people say, boy, when they hear about cancer, and they say, all right, they think private only, and they think expense, and they think, well, I don't have that money, and, so they start to...
That definitely, I think, contributes, because I'm not even going to pretend that cancer treatment is not expensive. It is expensive. There's expensive and there is more expensive. And the more expensive comes with the private care, comes with more advanced treatments. But even in the public sector, for a lot of people, the treatments are going to be expensive. And it's not like diabetes, where every month you can try to find some money for your medication. You kind of have to find all of this money upfront. Because once you're diagnosed, the longer that you wait and not do anything about it, the cancer continues, right? So you have 6 to 8 months of intense treatment, whether it's surgery and then chemotherapy or the other treatments, or whichever way that you do those. And yes, patients already begin thinking, I can't afford it. Whether it's because we've been conditioned to think that the only way we're going to survive is if we go see a private doctor or get private care because of the fares in the public sector, or if it is because of how advanced your treatment actually is, we really need to dispel those fears, because the same very good treatments are available in the public sector. And it is very distressing to me every time that a patient comes in and they've delayed their treatments, or they've had treatments very haphazardly because they're waiting to get a $2,500 for one cycle, and they have to wait like 3 months in between. That's not any way to treat your cancer. And I'm not saying that all of cancer treatments in the public system are going to cost $2,500, but I can tell you that you'll probably get 2 or 3 or even more of your cycles with that same $2,500 for the same medications. And patients tell me up until a few weeks ago, I did not know that. And I find that very, very hard to believe because, again, maybe it's certainly not information that we put out there very regularly, right? We talk about a breast lump, we talk about mammograms, we don't speak about come to the public sector. We work in the public sector. So yes, I work at Tapio, but I'm in the public sector. I'm at OKEU. I have a clinic at OKEU. I'm at OKEU every single day. Most of us who are consultants, physicians, who have our private offices, we also work in the public sector. And while not all of us will do what we have to do for every patient, a lot of us don't discriminate whether you have money or not. So if you come to my office and you have a cancer, let's just say we've diagnosed you, and you can't afford treatment in the private sector, you get a note written at that same appointment and you come to see me almost the next week or the week after in the public sector. If you need a referral to the oncologist, even if you've started privately, you have a right to get referred to the public sector. We need to stop, and this is, for the colleagues of mine and, persons who are just out there who know better. We really have to think about the patients. Not everybody can afford. The majority of us, I don't even know, God forbid, if I were diagnosed, that I would be able to pay for everything privately. It's available publicly. And I think we need to focus on the patient. Yes, we all have to live, but focus on the patient. And patients should also know that the same care is available in the public sector. So I know there's a lot of talk about OKEU, what's available, etc. But we have really worked in the last 2 to 3 years to make things available, certainly affordable. Sometimes even medications from some of the private pharmacies cost less, but we give you access. So you need to know, you need to ask the questions, you need to be aware that everything that's just about, not everything in general, but everything that for cancer care in St. Lucia that's available privately is available publicly. Okay, and I think that's an important message because I think it has served as a huge deterrent for cancer care for some of our patients.
I think that's a nice note to leave it on, to wrap up. I think we want to leave it right there because we don't want to confuse that conversation. Right. I think they need that message more than ever, especially now.
Yes.
But drive home for
it's October. I don't like October. I like the other 11 months of the year, but it's a place to start. It's a place to bring that awareness. Breast cancer happens every single day. Patients need your help every single day. So if you're listening, if you're aware of what it is that we're seeing, I task you with passing on that information. Also, volunteering of your time. It's not just money, it's time to help patients, it's time to bring your fundraising ideas. Everybody who is going through a cancer journey needs help, whether it's financial, whether it's emotional, whether it's a simple thing like taking their kids to school while they're going through treatment. There is always something that each of us can do to make somebody else's life easier. So don't ever think that you can't contribute. And we don't wish that for anybody, but you just never know where life is going to take you.
Yeah. Absolutely. Thank you, Doc.
Thank you.
It's an honor and a pleasure.
Thank you.
And we appreciate you and your service.
I appreciate it.
We'd end this segment with, you know what, a lot of people, we talk about it, we hear about it, even myself. I didn't really know, I thought I knew how to really do a self-breast examination. You first must look and then touch. Here's a little guidance.
This has to be done 12 times for the year or once a month. This is done to familiarize yourself with the breast so that you can notice any changes at an early period. The first thing that you need to do is to look at yourself in the mirror. Without a bra on, you're going to look at your breasts. You're going to check for any changes in size, changes in color, or the changes in the texture of your skin. So first thing, you look at your breast. The breast is normally slightly bigger than the other, but it is not so much bigger that you would completely notice it. So you're going to look at it from the front, then you're going to change to your side and check to see if there's any changes in the size of the breast. The next thing that you are going to do is to look at the changes in the color of the skin. Does it look kind of reddish, kind of purplish in color, dark in color, almost like you have gotten a bruise? The third thing you're going to look for is if you've seen any dimpling in the skin. The dimpling would mean that if there's any cancer there, that it has been pulled in. So it looks like what we call the orange skin look, not that your breast looks orange, but that it has little dots on it showing that it's been pulled in. So these are the three things that you're going to be looking for. From there also, you want to look at your nipple. The nipple in itself, it's normally protruding, and for some persons it may be flat. What you're going to look for in that nipple is whether or not it's been pulled into the skin. I will demonstrate this, showing that, as you can see, the nipple hair is out, it's protruding. But what would occur is the nipple would go into your breast, being pulled in, okay? So this is the fourth change that you are looking for. When you have done that, you're going to put your hands onto your waist. What we call the Supergirl or Superwoman pose. You're going to do this. This is done so that you watch the motion of your breast. Whatever you do, your breast should normally move and follow that, what you are doing. So if you notice, once I do this, my breast will become more up and it will protrude out. So this is what you want to see. You want to see that your breast follows you. The next thing that you would do is you would go forward. This is done because you want to see that the breast, again, that it follows you. One should not stay up much longer than the other. It should just go down together. Okay? We are looking for that movement. If there's anything cancerous in there, it will take a little longer. One will take a little longer to go down than the other. Once you have done that, the next thing that you would do is you would lie down on your bed, or you can do it in your shower. You're going to open up your chest, okay? And our breast is actually a box. It goes from this way, it goes under, and it comes all. So your breast is not just this area, it's all on top here and also going underneath the arm, okay? This area is very important because we have lymph nodes there, and this can cause the cancer to spread much more easily because it goes all around and there's a very heavy blood supply in that area. So when you have opened up your chest, whether it be on your bed or in the shower, which sometimes can make it a little bit easier, you are going to take your 3 fingers, not the tips of your fingers, but the pad part, the padding part, not the tips. And you're going to make 3 motions. Now you're going to have that in light, a little deeper, and as deep as you can go, because we want to move from the skin, the fat, and also the muscle area. We are looking for something that can be very small, pea-size, and not moving. The glands in our breast, they move all around. That is normal. But if there's something that is cancerous, it tends to stick in that area because it needs a blood supply for it to get bigger and bigger. So you're going to go 1, 2, and 3. When you go into the next area, you can either choose whichever one is more comfortable for you, go down towards the breast, or you go in a clockwise motion all around. You don't want to lift your fingers, you want to bring them across, whether it be this way or this way. You're trying to get as much of your breast as possible. So you go across and you do the same, light, deeper, deeper. Light, deeper, deeper. And remember, you're looking for something that is hard and not moving. When you have gone all around, and this should take at least, for most people, 15 to 20 minutes for going all around for each breast, you're going to do a C, okay, hold underneath your breast and the top, and you're going to do what we call milking. You're going to squeeze from the top with your thumb, come down, squeeze until you reach the nipple itself, and you're checking for if anything comes out from that nipple, whether it be something brownish, bloody, yellowish, and sometimes white, or clay. Normally nothing should come out from the breast, but if you are on contraceptives or if you are breastfeeding at the time, milk may come out according to the age of your child. Okay, so this is what we do once a month. Every month it should be done at least 1 to 2 weeks after your period, because during your period time your breast tends to be much more lumpy and much more painful and sensitive. So do this once a month, 1 to 2 weeks after your period. Thank you very much.
So now you have all of the information. Well, you had some added on information as well. So what are you going to do with the information? That's the question right here. Having the information, I had this quote that said, knowledge isn't power unless put into practice. So with that in mind, go on out and do what you do with the knowledge that you have today.